To everyone joining us virtually, on behalf of the Union County Prosecutor's Office and our partner Prevention Links, welcome to today's second annual Operation Helping Hand virtual event. Thank you so much for joining us. My name is Lyndsay Ruotolo, and I have the honor of serving the people of Union County as acting prosecutor. I am so grateful for the opportunity to talk to all of you today about a program of which we are extremely proud, Operation Helping Hand 24/7, 365. What started as a week-long initiative conceived by Attorney General Graywall when he served as Bergen County prosecutor, OHH was quickly adopted by Union County in 2018. At the time, I had the privilege of serving as an assistant prosecutor, and with Captain Webb, who you will hear from shortly, Morgan Thompson of Prevention Links, and a dedicated team of recovery coaches and law enforcement officers, we were able to facilitate access to recovery services during our inaugural week-long initiative 4 years ago. Building upon General Graywall's initial concept, we launched OHH 24/7, 365 in January of 2020. And now, every time a member of the Union County law enforcement community places someone under arrest for a possessory level opioid offense, that individual is immediately offered an opportunity to get help and begin the road to recovery through our partnership with Prevention Links. This happens not just 1 week a year, but every day, every hour, all year. While connecting with individuals at the time of arrest for opioid use is vitally important, we know that members of our community in the throes of addiction do not always encounter law enforcement. Because of that, OHH 24/7, 365 also offers a 24-hour hotline staffed by Prevention Links recovery specialists available to field calls from any Union County resident ready to begin their recovery journey. That number is 1-855-825-3275. In a testament to OHH's ability to adapt throughout COVID-19 when the uncertainty of disease transmission through face-to-face interactions became a threat to the safety of law enforcement and peer counselors, our outreach efforts transitioned to phone calls. Members of UCPO's detective staff individually called hundreds of Union County residents with a documented history of substance use disorder to offer OHH's services. As recently as this month, we again adapted the OHH 24/7, 365 model to best meet the needs of our community. Following the arrest of 4 defendants known to profit from the addictions of those frequenting an open-air narcotics market in Elizabeth, members of UCPO, the Elizabeth Police Department, and Prevention Links set up a pop-up event at that very same market location. On the morning following the arrests, would-be buyers coming to the neighborhood to purchase illegal opioids were instead met with an opportunity to change their lives. During the 4-hour pop-up event, 25 residents engaged with recovery specialists from Prevention Links. Seizing on this unique opportunity in the break of supply enabled us to meet people where they are, to impact positive change, and decrease the demand for these drugs in our neighborhoods. As we continue our efforts to combat the opioid pandemic, save lives, and prevent crime, sharing our story with community members like you is vital to our mission. In the past 5 years, over 600 members of our community have lost their lives due to fatal overdose. Addiction does not discriminate, and you may know someone who would benefit from Union County's OHH 24/7, 365 program. I urge you to share our program far and wide and encourage loved ones to begin the journey to recovery. Today you will hear more about Operation Helping Hand 24/7, 365 from Captain Webb, head of UCPO's Major Crimes Division, which houses our opioid task force, among other critical units. You'll also learn the signs and substances associated with opioid use from Sergeant Nicholas Veltre. You'll hear from Prevention Links Director of Recovery Support, Sabrina Sabater, and Recovery Engagement Manager, Brunke, on how COVID-19 has impacted access to recovery services. And finally, I am so pleased to once again be joined this year by OHH participant Rosalie Howard, who has now been in recovery for 2 years after beginning her recovery journey through Operation Helping Hand. Thank you for joining us for today's program.
Thank you, Prosecutor Ruotolo. Traditionally, Operation Helping Hand has been an arrest-based in-person operation where we arrested people for possessory drug offenses, and then following the arrest, we would immediately introduce the arrestee to a recovery coach from Prevention Links. Our goal with this model was to immediately get people help and have them meet with Prevention Links so they can start the process of seeking recovery services. In 2018 and 2019, we did this by conducting week-long operations, and then in 2020, we moved to a model wherein we conducted one-day operations once a month with the goal of then doing a week-long operation in the summer months. However, due to the COVID-19 pandemic, we had to suspend all in-person operations to ensure the safety of potential participants and, of course, our officers. Because of this, we had to dramatically change the way that we did Operation Helping Hand because we wanted to continue helping people. So what we did is we started having our detectives call people who live in Union County and have had substance abuse issues in the past. Our detectives would call these people and direct them to the Operation Helping Hand 24/7, 365 help hotline and connect them with Prevention Links. And in some cases, we were able to make that connection immediately, and in other cases, they would call in the future. This approach was not quite as effective as our arrest-based model because that was a scenario where we can get more immediate help, but we did have some success. So as the COVID-19 cases start to decline and continue to decline here in Union County, our goal and our plan is to start conducting in-person operations in the near future because we feel as though this is a more successful model. Unfortunately, the issue of substance abuse did not stop because we were in the middle of a pandemic. Many people still continue to need help, and one of the goals of our presentation today is to help parents identify signs of substance abuse. It's incredibly important for parents to be aware of these signs, and Sergeant Nick Veltre is going to conduct a presentation to show you how certain drugs are concealed, ingested, packaged, and distributed so you can identify certain signs. Sergeant Veltre has been an investigator at the Union County Prosecutor's Office since 2013 and is currently assigned to the office's Intelligence-Driven Prosecution Unit. In this role, Sergeant Veltre investigates instances of narcotics distribution, gang criminality, robberies, firearm-related offenses, and other violent crimes. Before joining this unit, Sergeant Veltre was assigned to the Narcotics Strike Force, Juvenile Unit, and Criminal Case Control Unit. Through his work on hundreds of investigations, Sergeant Veltre has become an expert on how narcotics are concealed, ingested, packaged, and distributed. Using this knowledge, Sergeant Veltre educates the community with presentations on cyberbullying and harassment, gang awareness, and narcotics awareness. In addition to his investigative and community outreach work, Sergeant Veltre teaches several classes to incoming police recruits at the John H. Stamler Police Academy, including lessons on narcotics awareness and recognition, developing sources of information, and gang awareness. Sergeant Veltre also teaches in-service courses to members of Union County law enforcement on conducting narcotics investigations.
Good evening, everybody. My name is Nick Veltre. I'm a sergeant with the Union County Prosecutor's Office. Today I'm going to be presenting some indicators and certain things to look for that may be indicative of heroin use and or the paraphernalia or certain items associated with different controlled dangerous substances that we see here in Union County. I put together a presentation for you that I will share now. Some of the drugs that we commonly see in Union County are listed on the slide. Today we're going to specifically talk about heroin and or fentanyl, as well as prescription drugs. Heroin is a synthesized form of morphine from the naturally occurring constituent of opium. It's a beige, almost brown powder. It's regularly injected, snorted, or smoked. Powder form is most popular on the East Coast. I'll show you some photos of what everything looks like. Powder is usually mixed with certain cutting agents such as sweetener or quinine in order to increase the dealer's profit when selling it on the street level. This is what we commonly know or see as raw heroin. It's in a powder form. It's similar to powder cocaine with like a brown tint to it. These are some of the higher level investigations that we've done, and some packaging that we've seen associated with high level drug trafficking organizations that bring heroin into our country. As you can see, it comes in many different shapes and forms. It's smuggled into our country by any means necessary. Another issue that we're having is a lot of our heroin that we're sending to the lab during investigations that we've conducted is testing positive for fentanyl. Fentanyl is a powerful synthetic opioid that's similar to morphine and heroin, but it's up to 50 to 100 times more potent. It's a Schedule II prescription drug, and it's typically used to treat patients with severe or chronic pain in order to manage pain after surgery or treat those who are physically tolerant to other opioids. The scary thing about fentanyl is it comes in many different shapes, sizes, and forms. We've seen it in pill or tablet form. We've seen it drop on blotter paper like small candies, in eyedroppers or nasal sprays, or made into pills that look like actual prescription drugs. As I said earlier, majority of our suspected heroin seized during law enforcement investigations is currently testing positive for fentanyl. The packaging is very similar and the effects are the same as heroin, but for a street level distributor, the cost is significantly less. Normally, heroin users are unaware of the fact that they're consuming fentanyl and can't tell the difference between the effects. Some drug dealers are mixing fentanyl with other drugs as well, such as cocaine, methamphetamine, and MDMA. This is because it takes very little to produce a high with fentanyl, and it makes it a cheaper option for the consumer. So most commonly, we'll see heroin packaged in glassine envelopes, as I have pictured here. The glassine envelope itself, when folded, is about the size of a nickel. It commonly has a stamp or dealer marketing. Street level, we'll see possibly one of these possessed by a buyer, or up to 10 folds, which is known as a bundle, secured by a rubber band, or even a brick, which is 5 bundles, or 50 folds, which is commonly wrapped in magazine paper. And I'll show you a photo of what that looks like. The sleeve is some of our mid-level or higher level investigations, but those are 5 bricks taped together. So we talked about a fold. A fold is essentially a single dose of heroin and or fentanyl. As you see on the screen, it will have that dealer marketing or brand. In certain investigations, we're able to follow that brand, but that's not always the case. Dealers often switch their brand and label weekly and or monthly. 1 dose is 1 fold, and that's approximately 1/100th of a gram. And that's a single dose of heroin. I'm showing you a photo of 4 bundles of heroin and or fentanyl. As I said before, a bundle is 10 of those individual glassine envelopes rubber banded together. So certain things to look for if you believe that your loved one, family member, coworker is involved, or it may possibly be taking heroin and or fentanyl, are these folds, the small rubber bands. As you can see, they're very easy to hide and conceal. But if you know what you're looking for, it might be right in front of you. As we talked about bricks, you might see if a user is out to purchase a weekly or a few day supply of heroin for him or herself, they might be purchasing a brick of heroin, which again, like I said, is 50 folds. You can look for that magazine paper often toward open. Below are 5 bundles there. Like I said, very small, very easy to conceal. That's a brick there, and like I said, it's very easy to conceal, about the size of a quarter. And there you can see the individual doses of heroin bundled together. There's your dealer marketing stamp, which in this particular case is KO, or knockout with punching glove. Here we have individual glassine envelopes sealed within shrink wrap or plastic wrapping. Next, we'll talk about some ways that heroin users ingest their drugs. A lot of the times we'll see certain indicators, and what we look for is our heroin needles and or the orange caps. We often may see spoons, metal spoons, which are used for cooking the heroin before it is ingested or injected. You can look for multiple lighters. Certain heroin users will inject their heroin, so it needs to be cooked prior to. So you will see lighters in the area. You may see rolled up dollar bills or bills used for snorting, and when it's in powder form. And again, just some indicators to look for. The heroin is cooked on a spoon with whatever heating element, a lighter, filled into a syringe and then injected. Some indicators of heroin use are, as far as physical appearance, you may see tiny pupils, sleepy eyes, a tendency for the user to nod off, slow breathing, flushed skin, or runny nose. Some of the behavior might be vomiting, scratching, slurred speech, complaints of constipation and or nausea, loss of appetite, or covering their arms with long sleeves to cover up injection points on their skin. Next, we'll talk about prescription pills. Often what we see is a heroin user will ultimately start with prescription pills due to a sports injury or a work-related injury. And unfortunately, based on the cost of prescription pills, especially on the street level, they will transition into heroin because it's too expensive to continue with those prescription pills. We're seeing widespread abuse, especially in suburban towns and amongst teens and young adults. The semi-synthetic opiate derivative, oxycodone, is the most prevalent under brand names like Oxycontin, Percodan, and Percocet. We often see users will crush their pills and snort them to quickly obtain the effects in what is meant to be time-release medication. As I said earlier, the price will vary for prescription pills, but commonly on the street level, pills are no less than $10 to $15 for a single dose or a single pill, whereas heroin on the street level for a single dose can cost from $3 to $5. There's many names associated with prescription pills. As far as street level names, Oxys, Blues, Whites, Roxys, or Perks. Ultimately, kids specifically have no clue what they're really using. Oftentimes we'll see these pills test for pure heroin, fentanyl, or methamphetamine. So if somebody believes that they're taking oxycodone pill, it can potentially be something far worse. There are pill identification applications that you can get if you do find a pill and you're unaware of what you're looking at. Please use gloves because, as I said prior, you may be in possession of raw heroin or fentanyl. But there are pill identifiers that you can look up on Google to find out what you're actually holding in your hand. And by pill identifier, as you may have seen, a lot of pills, or a majority of pills, will have a marking on it, and you'll know what to look for. As I said prior, heroin can be disguised as oxycodone. As you can see, there's some discoloration there in the pills, so it might not look like a legitimate pharmaceutical brand produced that pill. But some of the pills that we see that are disguised as oxycodone are quite legitimate. Be careful with what you're handling. Indicators of painkiller use is somewhat similar to heroin use and/or fentanyl use, and they have some of the same physical appearance indicators. Constructed pupils, drowsy and/or confused. The user might experience a slow breathing rate. Their behavior, some of the behavior they may exhibit is not feeling pain, complaining of nausea and/or nodding off. Getting help. If you suspect your child or loved one is using illicit drugs or opioids, get help. Don't be confrontational. Addiction is real. About 38% of adults in the U.S. are battling some sort of illicit drug disorder. You're not alone. Call UCPO, our office, or local police for resources and guidance. Numerous individuals call us regularly for help. As Captain Webb stated earlier, Prevention Links, if you go on their website, there's plenty of resources, pathways to success. I've listed my personal cell phone number at the bottom. Thank you, stay safe, and be well.
I am now pleased to pass the program along to our friends at Prevention Links, who in addition to being our partner throughout Operation Helping Hand, also work each day to empower and foster healthy communities in the prevention of drug, tobacco, and alcohol-related issues. Joining us next is Philip Brunke, one of the newest supervisors in the Recovery Support Division of Prevention Links, having joined the agency in January 2021. He earned his bachelor's degree in psychology from Lehman College of the City University of New York. Philip is a person in long-term recovery, recently celebrating his 4th anniversary in recovery. As a recovery support supervisor, Philip supervises the Union County Helping Hand 24/7, 365 hotline, in collaboration with the Union County Prosecutor's Office and the Rise Up Recovery Center, part of the Union County Peer Recovery Center.
Thank you, Captain Webb. My name is Philip. I'm the Recovery Support Manager at Prevention Links, which is the agency that provides the peer support services of Operation Helping Hand. So Operation Helping Hand is done in conjunction with the Prosecutor's Office. Our side of the operation, Prevention Links provides the peer support staff to any participants enrolled in the program. Operation Helping Hand utilizes a peer support recovery model in which individuals with substance use disorders are engaged with a peer recovery specialist for an ongoing period of time. The participants are provided guidance, support, assistance in accessing treatment, and community-based recovery support. Participants are followed up with weekly by a peer recovery specialist while navigating the early stages of recovery and linked to services as needed, such as getting to treatment, referrals to meetings, and so on. It is available to any Union County resident 18 years of age or older that's facing a substance use disorder. They're given 24-hour access to recovery specialists using the Union County Helping Hands hotline. But what exactly is substance use disorder? Substance use disorder is a chronic, often relapsing disease that causes compulsive drug seeking and use, despite the harmful consequences experienced by the person using and those around them. The Federal Agency of Substance Abuse and Mental Health Services Association, known as SAMHSA, defines recovery as a process of change through which individuals improve their health and wellness, and live a self-directed life, and strive to reach their full potential. The guiding principles on the left of the screen help outline a person's individual recovery. What are peer support? Peer support advocates for people in recovery, sharing and identifying resources, helping the participant identify their strengths, building community and relationships, leading recovery groups, mentoring and setting goals for the participants, providing services and/or training opportunities. We also supervise other peer workers and educate the public and policymakers. A peer recovery specialist is an individual with lived experience of substance use disorder and is actively engaged in the recovery process. They have completed specialized training in how to purposely and appropriately leverage that experience to assist the individuals with substance use disorders in their journey to long-term recovery and well-being. The lived experience breaks down the barriers of judgment. The peer and the person they are serving have had similar experiences, and the peer is there to walk side by side with them through the journey, not to tell them what to do like a parent or a doctor or a therapist might have done. So the impact of COVID-19 with those with substance use disorder, out of the 21 counties in New Jersey, Union County was ranked 6th overall with COVID cases as of April 16th. There are 249 newly reported COVID cases and 7 newly reported deaths as of April 14th. The New York Times reported from September 2019 to September 2020, there were 87,000 deaths in the United States due to overdose. The National Institute of Health in the United States, there were 67,000 drug overdose deaths reported in 2018, 4.1% fewer than in 2017. The lockdown reduced access to healthcare facilities, such as those that provide medicated-assisted recovery. Approximately 37,000 fewer individuals were able to receive assistance because of the pandemic. According to the Center for Disease Control and Prevention, as of June 2020, 13% of the American population reported starting or increasing substance use as a way of coping with the stress of COVID-19. The CDC also reported that drug deaths spiked in the first 6 months of the pandemic, up approximately 27% compared to the same period of time in 2019. From August 2019 to August 2020, approximately 88,000 people in the US died from illicitly manufactured fentanyl and synthetic opioids. Medication-assisted treatment has been shown to prevent overdose deaths. So disruptions in access to treatment have likely played a role in increasing overdose death during the pandemic. The further impact. The CDC recently reported that an analysis of the electronic health records of 73 million patients across the United States, approximately 10% of that population sampled have substance use disorder, and of that 10%, 12,000 had COVID-19. People with substance use disorder are significantly overrepresented among those with COVID-19, making up about 15% of the COVID group versus just 10% of the total sample. Risk of COVID-19 was highest among those who were Risk of COVID-19 was highest among those who had received a diagnosis of substance use disorder within the past year. Those with a recent opioid use disorder diagnosis were 10.2 times more likely than those without a recent substance use diagnosis to have COVID-19, followed by recent diagnosis of tobacco use disorder, alcohol use disorder, cocaine use disorder, and cannabis use disorder. Patients with lifetime substance use diagnosis also experience more severe outcomes from COVID-19, including hospitalization and death. The reason for the increased risk of COVID-19 infection and adverse outcomes among people with substance use disorder are probably complex. First, many kinds of chronic substance use harm or weaken the body in ways making people whose substance is more vulnerable to infection. Opioids compromise respiration. The slowing of breathing caused by opioids can lead to hypoxia, reduced blood oxygen, which can harm the brain as well as compromise cardiac and pulmonary systems. Behaviors associated with opioid use and certain other kinds of illicit drug use Behaviors associated with opioid use and certain other kinds of illicit drug use also raise the risk of contracting infectious diseases of all kinds. This graph shows the trend for Union County, the number of recorded deaths over the past 6 years. Overall in the state, in 2019 and 2020, there were 3,000 suspected drug-related deaths. In the first 2 months of 2021, there have already been 540 deaths in the state. And you can see in 2019, there was a peak for Union County of 147 overdose deaths. And in 2020, it was 143. But even in the first 2 months of 2021, there were already 28 people dead from drug use. The New Jersey, this graph shows you the drug overdose death trend over the past 10 years for the entire state. This information was compiled by the Drug Monitoring Initiative, which works across municipalities and jurisdictions for reporting purposes. The last 2 years on the graph of 2019 and 2020 are still pending the state medical examiner's verification. But you see from 2010, only 843 overdose deaths in the state to over 3,000 last year alone. The COVID-19 pandemic created a situation that many people were not used to. Working virtually, if working at all, and staying home, led to increased levels of anxiety because of the uncertainties of either no income or reduced household income. People also faced issues with family members because of the coexistence and close quarters during the pandemic. There were also a number of food insecurities, many people not knowing if they'd be able to put food on the table. Those seeking treatment were calling and reaching out for assistance, but the facilities themselves were not taking new patients. The New Jersey Department of Mental Health and Addiction Services reported a 17% decrease in admissions to treatment as a result of the COVID-19 pandemic. There were additional barriers, treatment facilities wanting test results of COVID to try to ensure the safety of other participants and the staff, as well as a reduced capacity for treatment in an already limited resource, because hospital facilities, for example, that have inpatient drug treatment programs, the beds were being diverted out of the inpatient program to assist with the COVID-19 hospitalizations. What peer supportive services was able to do was bridge the gap while participants were waiting for treatment facilities to take on new people. The staff met via Zoom and or over the telephone. We provided support in navigating those additional barriers, helped some participants get tested so that when a bed was available, they were able to report the additional requirement to the facility. We provided support while they waited for treatment availabilities, and we connected them to other resources such as online support meetings. Some general recovery services. There's residential treatment, detox facilities with partial hospitalization programs, intensive outpatient programs and outpatient therapies, as well as traditional conventional therapy or medication-assisted treatment, as well as peer-supported services. So here, I'm going to introduce to you a success story of Operation Helping Hand, a participant by the name of Rose. So we're going to take a moment and bring Rose up. Thank you.
Hi, my name is Rosalie Howard. I am so happy to return to this year's Operation Helping Hand webinar as I approach my 2 years in recovery, which is this month. Since I participated in the Operation Helping Hands webinar last year, I am excited to provide an update on how my recovery journey is progressing. I'm about to move to my own new apartment in Uptown Elizabeth. I have continued to improve my relationship with my family and loved ones, love staying in touch with my prevention link peers and recovery specialists, also Bridgeway peers. The Operation Helping Hands program has helped me a lot, and I want to give back to the program and encourage others to join as well because it works. Thank you.
Sabrina Sabater is the Director of Recovery Support at Prevention Links. Sabrina earned her master's in social work from Rutgers University and has been with Prevention Links since 2015. Sabrina has previously worked with adolescent students and families at the Raymond J. Lesniak Experience, Strength, and Hope Recovery High School, New Jersey's first public recovery high school. She assisted in the implementation of a number of peer recovery support programs, including Union County Community Law Enforcement Addiction Recovery Pilot Program, which included a hotline that operated from 8 a.m. to 5 p.m. for people to get connected with peer recovery support. That pilot has now evolved into Union County Operation Helping Hand 365. The hotline now operates 24 hours a day, 7 days a week. Sabrina participated in a number of initiatives with law enforcement and other community organizations working to increase accessibility to peer-based community recovery support services, including the implementation of the Experience, Strength, and Hope Recovery Center, which provides recovery coaching services, mutual aid meetings, and various sober social events.
My name is Sabrina Sabater, and I'm the Director of Recovery Support at Prevention Links. I have been with the agency for over 5 years and have had the privilege of working alongside our partners in a number of Operation Helping Hand initiatives and watched the program expand to provide 24/7 access. I am also a person in recovery. I understand the value and impact a peer recovery specialist can have on someone struggling with substance use. Today, we heard from some fantastic speakers, as well as a brave participant who is willing to share her story of hope with us. We also learned about the impact the pandemic has had on our mental health, and especially to those seeking recovery support services. If you find yourself struggling with problematic substance use or in need of peer recovery support and are in Union County, please call 1-855-825-3275 for access to recovery support, including linkages to treatment and other recovery support programs. We are here to help 24/7.